Hi everybody, Dr. Cary Yurkiw here. Today I'm going to go over some disc strengthening exercises that are good for disc injuries after the person's starting to heal, so their pain's reducing, they're doing some stretches, then strengthening is a good idea. And these are very good rehabilitation type of exercises for disc conditions. So the first thing that I want to go over is the side plank. And the way this is done is you're just resting your hips on the ground to start. The arm is down, the upper body is in a straight line like that, a neutral spine. And then you want to lift your hip off the ground, creating a neutral spine all the way down. So you want a kind of a straight line from your feet all the way up to your head. And that's going to keep a good alignment. It's going to work the muscles on either side of the spine, and it's going to make your spine and the discs, ligaments, and muscles around the spine stronger. The next is the extension exercise. So you start flat. You could put a pillow underneath you like that, and then you want to lift up just on your forearms like that. See how that feels for the low back, and if that's feeling pretty good, the next thing is to extend up with your arms extended like that. So it's going to put a little more extension in the low back. Again, check with your health professional before you do something like this, but this is good for extensions. These are for the side muscles. This is for stretching the front part of the discs and contracting the back part. The next one is this gluteal stretch. Now, depending on which disc is involved, this can be very good for the lower lumbar discs, like L5, S1, or L4, L5. And this is where you cross the leg over in a figure 4, and then you bring this knee up to your chest, stretching the gluteus maximus and medius here on the right side. Okay, then you're going to switch and do the opposite side, most likely both sides, just to stretch out the glutes on both sides, as well as that space between the spine and the tailbone or the sacrum. The next, the quad, arm, and leg raise. So what you're going to do here is be on all fours. You're going to lift one arm and then the opposite leg up and just hold that. That's going to build some strength, kind of like a plank. That's a good way to look at this. And then you're going to build strength and stability in the core in both the back side and the front side of the spine. Then you're going to alternate to the other arm and the opposite leg, then back down to neutral and switch to this side. And I would recommend 8 to 10 repetitions of this on each side. And then last, the dead bug. You start on all fours. You can lift one leg up and then the opposite arm, and you can extend that leg out if you want to, and just hold that. That's going to work the abdominal and core muscles and the stability of that. Then you want to put that arm down, switch to the other arm and the opposite leg, extend the leg out or just lift it off the ground, whatever you're comfortable with, and hold that, I would say, for 3 to 5 seconds to start, and do 8 to 10 repetitions on each side. These are good disc rehabilitation exercises because they work on stability and strength around the core. So it's very important that you build up the stability so you don't re-injure yourself and end up in a similar situation where you're hurting the discs in your back, and that's setting the treatments back. I would check with your health professional first. If you're a patient in my clinic, I'll give you specific exercises to do. It could be all of these, it could be some of these. And you can always ask me at your next session in the clinic, and I'd be happy to help you.